28-year-old patient, Nitin Sharma. Complaints? Painful blisters near lips, burning sensation before rash, similar episodes in the past. On examination, grouped fluid-filled vesicles seen over lip margin. Clinical suspicion, herpes infection. मैं हूं डॉक्टर अभिषेक। आज हम herpes को स्टेप बाय स्टेप समझेंगे। Causes, symptoms, diagnosis, treatment और prevention. What is herpes? Herpes is caused by the Herpes Simplex Virus, HSV. There are two main types: Herpes Simplex Virus type 1, which commonly causes oral herpes, and Herpes Simplex Virus type 2, which commonly causes genital herpes. However, both types can infect either location. How the virus behaves in the body. After the first infection, the virus enters the skin or mucosa, travels through sensory nerves, reaches the nerve ganglia, and becomes latent or inactive. It stays in the body for life. Later, due to triggers, it reactivates. Common triggers for reactivation include stress, fever, weak immunity, sun exposure, and illness. Reactivation causes recurrent blisters in the same area. Symptoms: oral herpes. It starts with a burning or tingling sensation known as the prodrome. Then, small grouped fluid-filled blisters appear, which become painful ulcers after they rupture, eventually crusting over the lip margin. The first episode may also include fever, a sore throat, and swollen lymph nodes. For genital herpes, symptoms include painful genital blisters, a burning sensation, pain during urination, and itching. The first episode is usually more severe, while recurrent episodes are milder and shorter. An important clinical feature is the prodromal phase, where the patient often feels tingling, itching, or burning before the blisters appear. Treatment during this phase is most effective. Diagnosis. In most cases, it's a clinical diagnosis based on the characteristic grouped vesicles, the recurrent pattern, and the location. If laboratory confirmation is needed, a PCR test from the lesion swab is the most accurate method. Other options include viral culture and blood antibody testing, though PCR is preferred for confirmation. Treatment, step by step. Important point: herpes has no permanent cure, but it is completely manageable. The goal of treatment is to reduce severity, shorten duration, prevent complications, and reduce transmission risk. Antiviral medications like acyclovir, valacyclovir, and famciclovir are commonly used. These drugs inhibit viral replication, reduce symptom duration, and decrease recurrence frequency. For a first episode, start antivirals immediately for 7-10 days. For a recurrent episode, starting during the prodromal, tingling stage gives the best results. For frequent recurrences, suppressive therapy with a daily low-dose antiviral may be used. Supportive care includes keeping the area clean and dry, avoiding touching lesions, and frequent hand washing. For prevention, avoid direct contact during active lesions, practice safe sex, and manage triggers like stress and sun exposure. If you are pregnant, consultation is required to prevent transmission to the newborn. Herpes is common. It is manageable. It does not define a person. Early treatment and awareness reduce complications. मैं हूं डॉक्टर अभिषेक। herpes एक कॉमन वायरल इन्फेक्शन है। अर्ली सिम्टम्स पे ध्यान दीजिए। प्रॉपर ट्रीटमेंट से आउटब्रेक्स कंट्रोल किए जा सकते हैं और स्टिग्मा कम करना भी उतना ही जरूरी है।